Ankle replacement in general is becoming more popular as a go-to treatment for ankle arthritis. So if you look over the last 10 years, we actually looked at the number of ankle replacements and the number of ankle fusions being done in the country, and we looked at the Medicare database. So ankle fusions are slightly going downwards, ankle replacements are going upwards. So the reason is that patients are generally happier with an ankle replacement. The ideal candidates for the Zimmer total ankle would be patients that are going to be a little bit older, usually above the age of 50 or 60, have advanced arthritis of the ankle. In other words, their ankle joint is worn out, and they're having difficulty walking and doing their daily activities. They have failed non-operative means of treatment like bracing, shoe modification, medication, and really are at the point where they can't tolerate the amount of pain they're having in their ankle. And specifically in terms of the x-rays and the radiographs, they should have no joint space remaining and basically not too much instability or deformity of the ankle joint, which lends itself to the ankle joint replacement. The Zimmer implant, you go in from the side and the ankle joint is curved. You know, it's curved like that. So you go in from the side and you recreate the geometry of the ankle joint. Whereas the other implants, you actually cut the surfaces flat and then you put the implant in that's got a curvature in the implant. The Zimmer implant, you actually cut the surfaces of the bone the way they're supposed to be, and you replace the implant exactly in the same geometry as the original ankle. It's like putting new tires on your car. You know, you got 100,000 miles, and the more you squeal them, the more you work aggressively, the shorter they're going to last. So ankle replacement and the Zimmer ankle replacement, I think we still need to be careful. Now, with the Zimmer, with the type of metal, the type of bonding to the bone, and the geometry being recreated, you know, perhaps we can be a little bit more aggressive. Now, I have lots of patients that come in that actually feel very good, and they ask if they can do activities. So the type of activities that we let them do is probably the more gliding activities, you know, elliptical exercise, hiking and walking, but not running, skiing, cross-country skiing. I think all those things are safe with ankle replacement. We know that the ankle arthritis patients suffer just as much as hip and knee replacements, but we still need that information that is it going to improve their quality of life with the ankle replacement. And so at this point, I think we still need to gather more data, but preliminary data so far, up to 10 years of follow-up of ankle replacements, it does improve the patient's quality of life significantly. And if you can relieve patients' arthritic pain, maintain their activities of daily living, and allow them to function, I think the patients are going to be very happy with the ankle replacement.